So your lower back.
Yeah, right here.
Okay.
And I'm a server right now, and so like the 8-hour like periods of just like walking, no sitting. As soon as I get home, I just kind of like let my like upper body hang because like I can just feel like it's like really tense back there.
Okay. I see it in the mid back too. It's coming from the mid back. Her head is over to the right, and then turn around and go back. Yep. And then come on back one more time. Okay, just stop right there. I can tell you kind of what's going on.
Okay.
Your head is over to your right.
Okay.
And you have a slight tilt.
Okay.
Any neck pain at all?
I know that like I can't turn all the way this way, but I can turn like all the way that way.
The muscles are just inhibiting you.
Mm-hmm.
They're
I just
so
never thought about it. I'm like
pulling you over to the right. I might go ahead and fix or take
whatever.
care of that, and then I'll move on to this issue here. So I'm going to take this and pull you down this way.
All right.
Okay. That should take some of the tension off of your low back.
Okay.
The adjustment will help as well. Close your eyes and you put your hands out in front of you. She's like, I can do that.
I was like, am I supposed to do it right now?
Yeah, right. Yep. And if she can hold it there, right, and you're looking for drifting. If she can do that, she's fine. So you can open up your eyes. You're gonna be okay.
Yeah.
All right. You let me know if anything feels sharp or is uncomfortable. Okay.
Got it.
Please let me know.
Mm-hmm.
Just take some deep breaths for me here. This is your good side. This is the side that's real tight.
Mm-hmm.
Right here. I see him.
Yeah.
There you go. I'm gonna use my knuckles a little bit in here. You tell me. Does it feel okay?
Mm-hmm.
Okay, take a deep breath in. We're gonna really go for it. Pull you back. Ooh, there you go. Is that too much?
Mm-mm.
Open up your eyes for me. Any dizziness?
Mm-mm.
No, feels okay?
Mm-hmm.
That's the real tight one right there. Okay, the adjustment will take care of a lot of that. Okay, let's go do that one. All right, chin back for me.
Oh, that was good.
Good one. Okay, does that feel all right?
Mm-hmm. Oh, good cracks.
That was out. that was dearly needed. Oh, there you go. There you go. That's it. See how that's much easier now?
Oh yeah.
You know. Wee! It just
I know, it's so
flops
flexible.
back over now.
I'm done.
I'm good. Just leave me. Pick me up in a half an hour. That's what I say. Good. I'm the master. Like, I don't think I've ever had my toes cracked. Not like that, at least. Good. Excellent. Little stuck over here, okay? Common for the right-hand side to be stuck. It usually is the stuck one.
Really?
Mm-hmm. I'd say 90% of the people. It's that right pelvis translation.
I wonder why.
Because you're leaning on your right-hand side.
Oh, okay.
Why is this up?
Got it. Oh, yeah.
You're
Sometimes
doing
at
this.
work, like, yeah. just
Yeah, you're
bumping it
leaning
up.
on the right hip, and the ankle stabilizes.
Oh.
It's not necessarily a terrible thing to have,
Mm-hmm.
but it gets jammed and stuck with the force that's being applied to it, so it just feels good to have it
Yeah.
loosened up a little bit, okay? None of this should feel sharp. It should just feel good.
How often do you like get work?
I try to get worked on once a week.
Yeah? Oh wow.
Yeah, I need it. I need it.
It's like kind of the questions like who delivers like the mailman's like
Mail.
Like who's the chiropractor's chiropractor?
I have lots of chiropractors in my family, so
Yeah?
it happens.
Oh, then yeah. Family reunions, Thanksgiving.
Yes.
Who's gonna pop my back?
All right, so then I'm gonna relax this hip. Ooh, that was everything. Good. Good. Okay, I don't need to go any more than that. All right, come on up and see how it feels. Face the window there. Now she has a pretty good curve. Feel a little easier to turn that way.
Oh, I can like completely like go like that. At first it was like kind of like there, but now I can go.
Yeah, it should just kind of move because that atlas that I moved is 50% of your range of motion.
Oh wow.
So if you can get that 50%,
Yeah.
it helps.
And I'll be like.
Yeah. Hands on your hips for me. And then elbow back.
Ooh.
Good. Very flexible lady. I do not have to put too much force into anything.
I feel like I just like pop like, not trying, I'm just like cracking all day.
I'm not pushing very hard to set these bones. Yeah, I just like a little push here and a little push there. I'm just setting them. I'm not.
Is that a bad thing if they pop easily, or is that a good thing?
It's genetics.
Okay.
It's in your genes, and it's the way you're made, and it's not necessarily bad.
Mm-hmm.
It just means you have to be careful not to, because you're flexible.
Mm-hmm.
Like especially me, I need to not go so hard on you.
Oh, okay.
Like even your ankle and everything. I was like, just a little tug, little push to set everything back in. I'm not wailing on you at all. Okay. Yep, there's that right. Most patients are like this. Classic 80% of the population. Okay, I am not saying anything out of the ordinary. You got normal aches and pains that everybody alive has.
Nice to know I'm normal.
Yeah, normal pain. This is easy fix. Okay, is my point. The easy fix.
Mm-hmm.
You just need to pop once in there.
You just need a pop once in a while. Yeah, so take a deep breath in for me. I'm gonna get another one right here, and out. Good.
Ooh.
Told you. I do a little test and then I go for it. So here we go. We're gonna do a test. No, and then we go for it. That was a little stuck. So one stuck spot on you I found so far.
If it means stuck, what does that mean?
Doesn't move like
Oh.
the rest of you. See how easy this one moved? And then in here, I'm. Oh, never mind. Forget it. Maybe it was just the act of surprise.
She was just shy.
Deep breath in. All the way out.
Ooh, good.
This is what you're paying me for.
I just hear it. I'm like, yeah, that's a good
Get
crack.
it. I know. I'm with you. And out. Perfect adjustment. Weird. I'm just like, oh, they just keep going.
I'm just like a bag of popcorn.
How much more do we got? Did I have them all? Okay, all right. They're in. Yeah, you feel that right there on the left. You are bruising.
Mm-hmm.
Okay. Those go away in 7 days.
No problem.
I'm going to check underneath here.
Mm-hmm.
Just make sure you're not bruising too much. So how did you find out about us?
You've come across my TikTok.
TikTok. Oh dear. Okay,
Yeah.
so TikTok is about a fraction, like a little blip
Really?
of what we do in here. Obviously, you've been through some of it already.
Yeah, you were just like, you came up and I was like, that's some good cracking right there. And then I like opened up and I saw that you were in Orlando. And I was like, okay, I'm here.
Excellent. Yeah, TikTok I show like 1 minute videos.
Mm-hmm.
And then usually my audience from TikTok is like, wait, what is all this? This wasn't in the video. Okay, we're gonna go do the glutes, okay?
Okay.
We're gonna go down all the way down here.
Okay.
All right?
Mhm.
I'm just letting you know.
Thank you for letting me know.
Always warn the patient. Always. Is this okay?
Mm-hmm.
Okay. I'll use my elbow right here.
Okay.
Because you got a knot right here.
Mm.
Right here. You doing okay?
Mm-hmm.
All right, you let me know. Oh, she's swollen right here. That's where you're hurting.
Yeah, lower back is just. Oof.
Yeah, look at that. Oh.
What does that mean? What does it mean if I'm swollen?
So this is where your pain is stemming from.
Mm-hmm.
So you're leaning to the right-hand side. This is being compressed. This is filling up with fluid.
Oh.
Okay, so it's going to trigger those pain receptors.
Mm-hmm.
Can you feel it?
Mm-hmm.
This versus this.
Yeah, the left side's a little bit more intense.
Yeah, a little.
Just a little. Just a bit.
I mean, look at that.
Yeah.
Oh my God, that's gotta hurt. You know, I'm
Yeah.
thinking, oh, I better be careful. That's gotta be killing her.
Yeah.
Yeah, right there. Okay. I'm trying to ease you into it. You know, and then so I open up this side. I try to track this side, open. Pull this side that way. I'm trying to straighten you out by force. By sheer force. How are you going to do this, Dr. Mondragon? My elbow and your back.
Teamwork right there. I just lay.
You just lay there and I do everything else. All right, just the top of your iliac crest. That's always enough. Just the top. With the roller, I'm going to go down this side, okay? Oh, there it goes. There you go. That's it. Yay! I do like a little party when it moves. Now this side doesn't have the problem, not nearly the problems as the other side.
Okay.
Nothing. I mean, the one little one here, but I wouldn't even say 20% of the other side.
Yeah.
Look at that. There's nothing. Clear. Clear. A little bit in the hammy. Not too bad, though. Tiny one right here.
Mm.
That's that ankle. There it goes. All right. Tickles.
Yeah.
Okay, wait. That's enough. There's not too much in there.
So the vein is like wrapping around your finger. Your other hand.
This one?
No, your first finger.
This one? This one?
Yeah.
I've always had it. I'm very veiny. Probably because my forearms are like overly vascularized from doing this my whole life. You doing okay?
Mm-hmm.
She's like falling asleep. Not quite.
I'm like, I don't know about that.
I can't usually show this on TikTok. It causes bruising.
Oh.
Are you okay with that?
Mm-hmm.
The bruises go away in 7 days at the most. Most of them will be gone in 4 days. Nobody will know anything had happened. Okay? Here's the scraper if you want to look at it. If you're a little intimidated by it. It looks like a knife,
Oh.
but it isn't. Sorry, and I've got oil on it now. But it's dull. You can feel it if you want. It's just metal.
Why is it bruised so easily then?
See, like if I do this on your hand.
It's just like the skin scraping that makes it bruise?
There's metabolic waste that exists underneath the tissues. And if I just, it's like rubbing a pen, like when we were kids running a crayon and a piece of paper over a penny.
Yeah.
You're kind of seeing the underlying structures. Now, the forearms really bruise.
Mm.
The back bruises a lot. The bruise is just a side effect of it. Like I said, if it itches, you can put aloe vera on it. If it's like an itchy feeling.
Okay.
But everything is gone with it. I haven't had one person, not one, out of the thousands that I've seen ever complaining about it, okay? I haven't had one. You know, but I'm not cutting your skin at all. It's just right to the surface. Well, oftentimes I don't even explain it, except for the fact that people wanted to know online.
Guadalajara?
Guadalajara.
Yeah. More so like Jalisco. Jalisco's the state.
Yeah.
Do you guys visit?
Nope.
Michoacan? No?
I know a lot about a country I've never visited. One of my mentors is from there. Chiropractic mentors is from Morelia, Michoacan.
Nice.
And he went back. He lived here in the United States. He went back. He's like, he thought that the United States just didn't have the care that he needed. He had to go back with his colleagues, he said. The chiropractors over there are much more like this kind of thing than what the Western medicine is. So a lot of this I got from him.
Yeah.
So you might be familiar with it. I'm sure he would have more to teach me. They do all kinds of funny things. Like cool, interesting ways to adjust the body. Pink is going to go away.
Okay.
Okay, but the dark purple spots are what takes 7 days.
Okay.
I'm going to clean you off here. You want to take a picture of it for her? We got pictures of Diego. So that's you.
Wow. That's crazy.
Yeah, I see your ribs.
Yeah.
Your costillas.
Exactly.
Yeah. So
Wow.
that, you see how this is a little bit more here too? I was kind of surprised that it was over here.
Yeah.
I would have thought it would come out here. It did come out down here on the left. You know, down in this side. But you have a lot of congestion up here.
Okay.
It doesn't always bruise like this. The
Okay.
first time you get this done is the most intense.
Okay.
So don't worry. It won't keep coming out like this every time you come in, okay? But the first time you come in, yeah, definitely. That's a good cleaning right there. And then look back. Ooh, perfect. Very good. Other side. Oh, like that. On your back. There you go. Bend your knees for me. Good. Now, this is the pubic symphysis, third joint of the pelvis, okay? So you have a joint here, here. That was what we just adjusted. This is the joint on the front. It's good at least once in your life to have it done.
Okay.
Okay? And squeeze a little more. Good. I'd say that was medium.
Okay.
You weren't too loose and you weren't too tight.
Okay.
So, okay, that means you probably don't need that one done every time.
Okay.
Come on up, see how it feels.
Oh, good already. Like I got up and I was like, oh yeah, that was great.
That's good. Okay. I don't mean to put you on the spot. I'm just
No.
saying, is there anything else that you want me to work on before I stretch?
No, I think that was it.
That was it,
just like
okay.
the lower back thing was like the biggest thing.
When you stand on the right-hand side, you're opening up this side over here on the left-hand side. It probably feels good to you to stand on that side.
I'm like, yeah.
Yeah, but you gotta try to go the other way.
These has to be on the other leg.
Stand on the left.
Okay.
So like if you're on your left, it's usually when people lay down on their left, they do this. They open up the left-hand side so their left shoulder is higher, and then they pull that hip down.
Okay.
This is very common for people as well. They like to lay on their left-hand side.
So lay on my right hand side?
Yeah, most likely.
Okay.
If you notice that you're doing this, you have to really be conscious of where your body is in space.
Right.
Or are you doing this when you lay down? Or are you doing this?
Yeah,
Sometimes-
I'm a side sleeper.
I'm pretty sure you sleep on your left.
Yeah, I don't even pay attention. I should then. Dang.
I'm pretty sure. Like, notice which way you face in your bedroom when you wake up.
Yeah.
Okay, yeah. Now, how are you gonna come off? And then you're gonna roll to the side. I do not want you to do a sit-up and undo everything you just did. Because you were on there for a good 10 minutes.
Or you're gonna have to do it again.
You're gonna have to do it again.